Good evening, aspirants. Hope you all are doing good. Welcome to Eternal Nursing Education. After a very long time, we all are meeting. Okay. होप आप लोग सब स्वस्थ होंगे, मस्त होंगे, अपनी पढ़ाई में व्यस्त होंगे. Okay. So after long, we are gonna have our classes today, and that is also on a very important topic, that is your infection control. Okay. Infection control means, we'll be studying all about it. Okay. What is infection? What kinds of means types of infections are there? Basically, what are the classifications? What are its causes? What are the possible sign and symptoms? Or how we can control it? How we can manage it? What are the precautions? A vast topic it is. Okay. So we'll be going slow and steady, so it will be going smooth for all of you all. Okay. So let's start. So today's topic is our. Okay, I'm writing it here. Okay. So before moving forward, okay, I would like to ask you some questions. That do you know anything about infection? What is infection basically? Means आप लोग क्या समझते हो infection के बारे में? If you means it's a very common term. It's a very layman term. Also, we are using it. Okay, that person has is suffering from infection. ऐसा मत करो वरना infection हो जाएगा. ठीक है? या फिर don't do that वरना infection हो जाएगा. Wash your hands before doing this, otherwise you'll be having infection. Otherwise you'll be having this infection, that infection. Okay, उसको ना infection हो गया. ऐसा जो हम लोग बोलते हैं. In a very layman term also, we are saying infection, infection, infection. So basically, what is infection? Infection means it is basically the invasion of any bacteria or any microorganisms or any pathogenic materials into your body. Okay, which can trigger your immune system and which can lead to your injury or any kind of delayed body processes, or which can lead to altered body symptoms. Okay, so what is basically infection? Okay, इन्फेक्शन मीन्स उसमें क्या होता है ना, बेसिकली इन्वेजन होता है. ठीक है, इन्वेजन और एंट्री. ओके, इन्वेजन और एंट्री ऑफ हार्मफुल माइक्रोऑर्गेनिजम्स, कोई भी, या फिर एनी पैथोजेंस और बैक्टीरिया. ओके, और बैक्टीरिया और वायरस or any kind of pathogens. Okay, so basically we understand that infection means any invasion or entry of कोई भी pathogenic organism हो गया, या फिर कोई microorganism हो गया, या फिर कोई virus हो गया, या फिर कोई bacteria हो गया. ठीक है, तो basically that is what it's called as your infection. So what it can do? It can do is ये क्या कर सकता है? It can lead to your altered body symptom. Okay, अल्टर्ड बॉडी सिस्टम, जिसमें कि क्या होता है ना, आपकी बॉडी में कोई चेंजेस आ सकते हैं, अल्टरेशंस आ सकते हैं. ओके, सो दीज आर द थिंग्स व्हिच कैन लीड टू इन्फेक्शन. एंड इफ सच थिंग्स हैपन, व्हाट आर द साइन एंड सिम्टम्स यू गोना सी? अगर ऐसा, अगर दिस प्रोसीजर इफ इट इज कैरिंग ऑन, एक्चुअली में अगर इन्फेक्शन होना होता है, तो ड्यू टू कोई भी इटोलॉजिकल फैक्टर्स, ओके, ड्यू टू any etiological factors, okay, which is happening. Okay, so any entry of foreign materials or pathogenic materials or bacteria, it has already occurred. Okay, तो इसने entry आपकी body में ले ली है. Okay, after that what will happen? After that it will lead to your body system is getting altered and your immune system is triggered. It will lead to provoking your immune system. Okay, immune system is triggered. Yes, either immune system is getting triggered. That means it will release और वो क्या करेगा उसके in return. Okay, if somebody is gonna beat you, somebody is gonna hit you hard, if someone is gonna give you a stab at your back, तो आप क्या करोगे? नहीं छोड़ दोगे? नहीं, you will also in return give a tight slap. Okay, ऐसा ही होता है. Okay, so it's not like your Mahatma Gandhi. Okay, someone is giving a tight slap on your one cheek, just show another cheek to that person. No, that is not gonna happen. So what we do? We are also giving a tight slap. Okay, that why did me hit me? So if any foreign materials or foreign pathogenic microorganisms that is taking entry into your body, so in return, आपका body भी, your body is also take some actions. Okay, it will release its antibody and all. Okay, so that is the further thing that we'll be studying further. But for now, we need to understand that this is the thing that is happening. Okay, so immune system is getting triggered, so due to which some sign and symptoms we gonna see. What now, the question is, कौन से sign symptoms आप देखने वाले हो? Okay, so basically what are the signs or clinical features that you're gonna observe in a person who is suffering from infection? Okay, so let's see that. Okay, so that is, next is your sign and symptoms. आप कौन से sign symptoms देखने वाले हो? फर्स्ट थिंग, ठीक है, नोटिस करना है आपको, थ्री, ये क्वेश्चन भी हो सकता है। ओके, समटाइम्स इट्स बीइंग आस्क्ड कि इन्फेक्शन हो तो उसके साथ इन्फ्लेमेशन इज को रिलेटेड विद इट। ओके, यू नीड टू अंडरस्टैंड। ओके, इन्फेक्शन एंड इन्फ्लेमेशन, these both are correlated with each other. Okay, am I clear to you all? Inflammation होना and infection होना, they are associated with each other, their sign and symptoms, their clinical features, it is being associated with each other. Okay, infection है तो that there might be probabilities there that inflammation can also take place in that area. ठीक है, तो इन्फेक्शन है तो इन्फ्लेमेशन होने के भी पूरे चांसेस रहते हैं। am I clear? yes, जैसे कि मान लीजिए कोई बेसिक सा चीज हो, मान लीजिए कि आपके सामने, फॉर एग्जाम्पल, नाउ HMPV वायरस इज अगेन originating, as we all know, आपने सुना भी होगा, in fact in Bhubaneswar also, you know, there already we had got a case that the person has been declared dead, and he was diagnosed with COVID-19 along with HMPV virus. ठीक है, डेथ भी हो चुका है। So we have to mentally, somewhere we have to be prepared that God forbid those situation na aaye, but still we have to be mentally prepared that we need to take some alert, we need to take some precaution. So the thing is कि अभी we mentally we have to stay prepared कि COVID आ सकता है. Okay, then HMPV virus, okay, it can also come and infect. So God forbid that should not happen, but mentally somewhere we have to be prepared that these things can happen. Okay, so that was a huge infection. Okay, that was a communicable infection. Okay, contagious. We were using masks. Okay, we were given certain instructions also, आपको ऐसे छींकना है. Okay, like not like that. Okay, आपको ऐसे, you have to take a sneeze. Okay, then what you have to do, you have to maintain a 6 meter distance, आपको maintain करना है. So many instructions उस time पे दिए गए थे. ठीक है, so not all the instructions we are not following all those things, but somewhere this infection is still persisting. Okay, so the infection means that can have a contagious nature जो कि communicate कर सकता है. Okay, from from one person to another person, it can get contact, it can get transferred. Okay, ये nature है infection का. Okay, so question will be asking कि ये infection हो या inflammation हो, उनका कुछ special features होता है, special clinical features, how you can diagnose it. So first symptom is your redness, swelling, and warmth. These things are the main key features or the hallmark features of inflammation. Okay, आप इसे key features बोलो या फिर इसे inflammation बोलो, आप कुछ भी बोलो, but these are the three main factors which are highly associated with your infection या फिर inflammation. Okay, along with it all भी बहुत सारे features है, but these three are the main features. Okay, so the basic main three features of your inflammation or your infection, that is your redness. कोई भी infection हो, first of all you will be seeing an redness. जैसे कि for example मान लो तो normally, okay, we are saying it common cold. It's very common. हर दूसरे दिन every alternate day a person is getting diagnosed with common cold. Okay, so you have consumed ice cream. Okay, now it's summer season, you have consumed ice cream, you are getting common cold. Okay, you have taken some cold sips, some cold coffee, okay, some smoothies or milkshake, okay, or cold water, you are suffering from your influenza or your common cold. So what happens? No, you're continuously sneezing in that. आपको बहुत छींके आती है. So due to which you can see the redness in your this side of nose. Okay, this side nose is getting reddened. Okay, आपने advertisements और commercial advertisements में भी देखा होगा कि they are, you know, doing that Vicks का commercial ad. उसमें क्या होता है? When you're rubbing that Vicks portion on the nose, no, तो उसमें क्या होता है ना कि ऑलरेडी वो लोग नोज को रेड दिखाते हैं, दैट मीन्स द पर्सन इज हैविंग इज और सफरिंग फ्रॉम कोल्ड. ओके, So that means that's the basic by visually we can also understand that the person is sick. Okay, eyes reddened and nose is red. Okay, so that means you understand that the person is sick or the person is being having some common cold. Okay, so that is the first thing, that is a redness. Redness in the area, कहीं पे भी अगर infection हो, the first sign is a redness around the affected site. Then swelling might be there. Yes, swelling हो सकता है, वो थोड़ा सा uplift हो सकता है, swelling हो सकता है, फूलना. Okay, and that particular site is feeling warm. Okay, वो particular site आपका क्या होता है ना, वो थोड़ा सा warm feel करता है. Okay, कोई भी जगह पे अगर इन्फेक्शन हो तो basically. So these are the main three features, clinical features of your inflammation या फिर infection. उसके साथ what are the some other features? Other features that is can be, it can be your increased body temperature, जो कि मैंने कहा अभी warmth. Okay, increase, just a second, sorry. Okay, increased body temperature, it can also lead to your fever. Yes, if the one thing you need to understand, fever is not a disease condition, it's just a sign. Okay, so fever hona means your body is fighting against any infection. Okay, your body is still fighting against an infection, that's why you are having fever. Okay, fever can be due to many causes. Okay, many reasons are there, but you need to understand, if you are having fever means your body is still fighting against that antigen or against that infection, due to which your body temperature is increased or high. Okay, am I clear till this? Okay, any doubts you're having, no, you just can ask us in the comment sections, mention all your doubts, will answer it as soon as possible. Okay, and don't forget to like, share and subscribe our channel, because your one subscription gives us the motivation to make to keep making important classes like this for you people. Okay, so the thing is this. Okay, so this is your body temperature. Okay, तो आपका क्या होता है ना, बॉडी टेम्परेचर इंक्रीज हो जाता है. am I clear? Okay, फिर उसके साथ और what are the other sign and symptoms? Other sign and symptoms, that is your most common sign and symptom, nausea and vomiting. कोई भी infection हो, ठीक है, या फिर any infection, infestations or any inflammation, nausea and vomiting is very common. Along with that, headache can be there. Okay, headache can be there. Basically आपको क्वेश्चन जो है इन तीनों में से आता है, that is the what are the key features of your inflammation, that is your first one is your redness, swelling and warmth. These are the three clinical features or key features of any inflammation. Along with that आपको और पूछे तो fever you can add. These nausea, vomiting, then headache, these are other factors, ये बाद में आ सकते हैं. Okay, then what are the other things? Other things आपको क्या हो सकता है? Diarrhea, you can also suffer from diarrhea sometimes. Any abdominal infection is there, diarrhea will be there, nausea, vomiting will be there, bloating will be there, tenderness. Okay, so these are the some important clinical features which is visible in case of your infections. Okay, ये हो गया आपके sign and symptom. नेक्स्ट कम टू व्हाट आर द कॉजेज. ठीक है, आपने समझ लिया कि इन्फेक्शन ऐसे होते हैं. ओके, दिस आर द क्लिनिकल साइन एंड सिम्टम्स, ऐसे दिखता है, इसका मतलब इन्फेक्शन हुआ रहेगा. लेकिन ये होता कैसे है, क्यों होता है, व्हाई इन्फेक्शन इज गेटिंग कॉज्ड? सो कॉजेस में बेसिकली डिपेंड्स ऑन द फैक्टर्स. ओके, बेसिकली फैक्टर्स मीन्स if the infection is caused due to any bacteria, okay, स्टाफाइलोकोकस बैक्टीरिया हो, ओके, देन आपके जो स्ट्रेप्टोकोकस है, क्लेप्शेल्ला, ओके, दीज आर द सेवियर बैक्टीरियल माइक्रोऑर्गेनिजम्स. ओके, अगर आपकी बैक्टीरिया की वजह से इफ यू आर सफरिंग फ्रॉम योर इन्फेक्शन, दैट इज कॉल्ड एज अ बैक्टीरियल इन्फेक्शन. सो कॉजेस कैन बी बैक्टीरिया, yes, then viral infection, example COVID-19, yes, then virus. Just a second. Okay, so these are the factors which can lead to infection: bacteria, then virus, then fungal infections. Fungal infection, athlete's foot. Okay, that is your tinea pedis, tinea corporis. Yes, so fungal infection or fungus or fungi, that. Okay, जो candida वगैरह. Okay, along with that other factors can also be responsible. Okay, if the person is immunosuppressant, okay, if the person is immunocompromised, okay, that can also lead to infection. These are the other risk factors. ये तो causes है, आप risk factors में उन्हें भी add कर सकते हो. Risk factors can be your, first is your आपका जो एनवायरमेंटल कंडीशंस है, यू नीड टू चेक दैट। ओके, एनवायरमेंटल कंडीशंस में सैनिटरी का आपका कैसा है, हाइजीन मेंटेन हो रहा है कि नहीं, दैट्स द वेरी वेरी इंपॉर्टेंट फैक्टर। वॉशिंग ऑफ हैंड्स, ओके, तो ये जो भी चीज़ें हैं, हाइजीन, ओके, लैक ऑफ हाइजीन, ओके, लैक ऑफ हाइजीन हो, कोई भी एनवायरमेंटल फैक्टर्स, ओके, ओके। फिर उसके साथ और भी बहुत सारी चीज़ें होते हैं, सैनिटेशन यू हैव टू मेंटेन, फूड हैंडलिंग, हाउ फूड हैंडलिंग इज बीइंग डन, ओके, दैट इज नीड टू चेक, ओके, तो वो भी रिस्क फैक्टर्स कॉज कर सकते हैं। इम्यूनिटी स्टेटस ऑफ अ पर्सन, यस, इम्यूनिटी स्टेटस ऑफ अ पर्सन, ओके, हाउ मच रेजिस्टेंस इज दैट पर्सन, ओके, तो आपका इम्यूनिटी कितना है, दैट ऑल्सो डिसाइड्स दैट हाउ मच यू आर गोना सफर ड्यू टू इन्फेक्शन। ठीक है, ये आपके कुछ कॉजेस एंड रिस्क फैक्टर्स हैं। सो बिफोर मूविंग फॉरवर्ड आई विल टीच यू सम टर्म्स विच इज वेरी कॉमन फॉर योर कॉम्पिटिटिव एग्जाम्स में पूछे जाते हैं। ठीक है, फर्स्ट ऑफ ऑल सम टर्म्स आर देयर विच यू नीड टू नो अबाउट दैट, जिसके लिए सम कंफ्यूजन्स आर आल्सो देयर, दैट व्हाट इज दिस, व्हाट इज दैट, व्हाट इज दैट, तो वी विल बी स्टडिंग इन डिटेल्स अबाउट दैट। ठीक है, तो सबसे पहला है व्हाट इज पैथोजेनेसिटी, पैथोजेनेसिटी, okay, what is pathogenicity, what is virulence, what is pathogenesis? I just need to know how many of you know about these things. These terms are very important in case of an infection, because infection of pulmonary means you need to understand in details about all these things. Okay, infection study. If you're studying infection means these are the factors which will be there, which you need to have your clear concept about it. Pathogenicity. Pathogenicity means till what extent. Okay, it is the ability of a microorganism. Okay, it is basically the ability of a microorganism to cause or to lead to, मतलब उसका कितना ability है to cause a disease, ability of causing disease, ability of what, ability of any microorganism, any pathogenic materials or your bacteria or your virus or fungi, anything, okay, उनका कितना ability है, how much capability they are having to cause a disease in you. Okay, मान लो you are the host, okay, you are the host, so in you how much they can cause disease, that is their ability. If they are very much strong, that means pathogenicity will be having a greater impact on you. ठीक है, ओके, इफ दे आर वीक, अगर वो उतनी कम, अगर वो उतनी स्ट्रांग नहीं है, दैट मीन्स इट विल बी हैविंग अ लेस इम्पैक्ट ऑन योर बॉडी। ओके, सो दैट इज द लेवल ऑफ देयर पैथोजेनिसिटी, कितना पैथोजेनिसिटी है उनमें। ठीक है, बेसिकली स्ट्रेप्टोकोकस हो या स्टेफाइलोकोकस हो या फिर क्लेब्सियला हो या फिर कैंडिडा, दे आर वेरी स्ट्रांग। ओके, सो दे हैव अ ग्रेटर पैथोजेनिसिटी इफेक्ट ऑन यू, दैट मीन्स उनका एबिलिटी बहुत ज्यादा होता है टू कॉज अ डिजीज। ओके, so pathogenicity means the strength of any microorganism or a pathogenic material to cause disease in you. Okay, that is called as your pathogenicity. I hope I'm clear till this. Okay, if you're still having doubt, you can ask me anytime in the comment section. Okay, I'll be free for you every time to answer all your questions. Okay, फिर आगे virulence. अच्छा, what is virulence? Virulence means the severity. Okay, it is basically the severity of disease या फिर इन्फेक्शन। मीन्स मान लीजिए अभी कोविड, ओके, आई एम टेलिंग यू कोविड, अबाउट द कोविड, ओके, सो यू नो द कोविड वायरस, यू नो व्हाट इट डज इज, उसका कितना विरुलेंस है, मतलब वो उसने अपना पैथोजेनिसिटी दिखा दिया, इट हैज कॉज्ड इट पैथोजेनिसिटी, इट हैज गॉट अ ग्रेट पैथोजेनिसिटी, इट हैज बीन डिक्लेयर्ड एज अ पैंडेमिक, दैट मीन्स द वायरस इज हैविंग अ ग्रेटर पैथोजेनिसिटी, उसने डिजीज कॉज करने का उसके पास वो कैलिबर, वो कैपेबिलिटी है, बट till how much extent it can go, it is if it is epidemic, ठीक है, उसका लेवल, उसका जो सिवियरिटी है till epidemic only it is lasting, no, but if it is pandemic means it has got a greater virulence. Virulence means severity, कितना severe हो सकता है। Okay, you are getting hit, okay, आप चल रहे हो, आप गिर गए, ठीक है, you are getting hit, you are getting some minor abrasions or any lacerations, ठीक है, but till what severity, how much severe it is, okay, that is the thing you need to know, ठीक है. तो पैथोजेनिसिस मींस एबिलिटी ऑफ डिजीज कॉजिंग, कितना एबिलिटी है उसमें. विरुलेंस मींस एबिलिटी जो है उसने डिजीज तो कॉज कर दिया, बट हाउ मच सीवियर इट इज, द लेवल ऑफ सीवियरिटी, दैट इज योर विरुलेंस. Okay, and pathogenesis means all the series caused by the pathogen, all the pathogens to development of a infection. Means वो क्या क्या procedures करता है, क्या क्या means all the steps taken by the pathogen to cause the disease in the host. Host means you. Okay, it is basically series of events basically taken place by the pathogen in the process of causing you ill. आपको ill बनाने में, आपको infection देने में क्या क्या procedures the pathogen has to take place, pathogen को कौन से steps complete करने पड़ते हैं to make you ill, that is the pathogenesis. Patho means infection, genesis means development. So how it goes, it undergoes few steps, कुछ steps होते हैं till which it can lead to infection. ओके, am I clear till this? ओके, सो ये जो है आपकी तीन चीजें हैं, ठीक है, पैथोजेनिसिटी, विरुलेंस एंड पैथोजेनेसिस. ओके, somewhere if you're not getting clear points, you can ask me anytime in your comment section. I'll be always answering you with all the concepts which I'm having right now. Okay, so these are the three few terms जो आपको पता होनी चाहिए before proceeding more about your infection. Pathogenicity, virulence, pathogenesis. ठीक है, now we'll be understanding what is the classification. हमने देखा क्या, we understood what is infection, okay, how it is caused, what are the causes, okay, what kind of sign and symptoms or clinical features it is showing on you, then what are the key terms, some terms which are related to infection, we understood that. Okay, now we understand the classification, which is very very important. Okay, classification of infection, it is very very important, note it. Okay, many times it comes in a questions also, so this is important. Okay, red means important, okay. So first classification is your primary infection. What is primary infection? Primary infection क्या होता है, ठीक, लिसन, आई एम द होस्ट, ठीक है, मैं होस्ट हूँ, मेरे को एक इन्फेक्शन होने वाला है जो मुझे पहले कभी नहीं हुआ. ओके, दैट इज बेसिकली, ठीक है, मुझे एक इन्फेक्शन हुआ है, ठीक है, ठीक है, आई एम हैविंग एन इन्फेक्शन जो मुझे पहले कभी नहीं हुआ है, ठीक है, जो मुझे पहली बार हुआ है, दैट मीन्स आई एम हैविंग अ प्राइमरी इन्फेक्शन, मुझे प्राइमरी इन्फेक्शन हुआ है, ठीक है. Means a person or an individual who is getting infected by a pathogen for the first time, any bacteria or any virus or any microorganisms, जिससे वो first time the person is getting infected, that is primary infection. Okay, next is your reinfection. Reinfection means आप नाम से क्या समझ रहे हो, what is reinfection? Means एक बार, okay, means the person okay, means I'm already in 2020 I was having COVID. Okay, in 2000 I got recovered, I have taken medications, I took all the treatments, okay, I recovered, but in 2021 I'm again diagnosed with the same condition, I'm again diagnosed with COVID. Okay, that means I'm again having a reinfection. Re means again, कोई भी इन्फेक्शन फिर से दोबारा होना, ओके, दैट इज कॉल्ड एज अ रीइंफेक्शन. am I clear? Yes, then comes your secondary infection. Yes, ठीक है, सेकेंडरी इन्फेक्शन मीन्स क्या होता है, ठीक है, आपको एक इन्फेक्शन हुआ है, ओके, You are having an infection, okay, while you are already infected with it, आपको कोई और infection एक और बार हो जाता है. Okay, means you know what, you are an infection which is happening in a person who is already infected with some other infection. Okay, उसको कोई और मीन्स पैथोजेनिक बैक्टीरिया या फिर वायरस से इन्फेक्शन हुआ रहेगा. ठीक है, फॉर एग्जाम्पल मेरे को ऑलरेडी आई एम हैविंग कोविड. ठीक है, आई एम ऑलरेडी इन्फेक्टेड एंड अगेन आई एम गेटिंग ट्यूबरक्लोसिस. ठीक है, तो मीन्स एनी इन्फेक्शन दैट इज टेकन प्लेस इन अ पर्सन हु इज ऑलरेडी हैविंग सम अदर इन्फेक्शन. ठीक है, दैट इज कॉल्ड एज योर सेकेंडरी इन्फेक्शन. अच्छा, फिर क्या आता है आपका iatrogenic infection. It's not okay. Okay, sorry. It is इधर से नहीं दिखता है ना. ठीक है ठीक है, एक सेकेंड. ठीक है, इज इट क्लियर टिल नाउ? ठीक है, iatrogenic infection. ठीक है, am I clear? ये आपका iatrogenic infection. Iatrogenic का मतलब the infection that is taking place in a person while having any medical or therapeutic procedures. मतलब ठीक है, मैं हॉस्पिटल गई हूँ बिकॉज मेरे को तो कुछ प्रोसीजर कुछ टेस्ट करवाने हैं, कोई भी डायग्नोस्टिक टेस्ट है. फॉर एग्जांपल आई एम गोना हैव माय लुम्बा पंक्चर. ओके, और तो उस टाइम क्या होता है, ड्यूरिंग दैट टाइम ड्यू टू आइदर not taking any proper precautions by the doctor or the nurse, so during that diagnostic procedure or during that therapeutic procedure I'm getting infected by any I'm getting infected by any infection. ठीक है, either I'm getting meningitis or either I'm getting tuberculosis. ठीक है, मेरे को infection हो जाता है during that procedure. I'm getting infected by that. Previously I was not having that, मेरे को पहले से वैसा नहीं था. ठीक है, but during that medical procedure or during the therapeutic procedure I'm getting that. That means it is called as your iatrogenic infection. Iatrogenic infection means the infection that is happening to you. आपको कब होता है, जब आप कोई diagnostic procedure या फिर कोई therapeutic procedure if you are going through during that time अगर आपको होता है, that is called as a iatrogenic infection. ठीक है, clear till that? फिर next क्या आता है आपका, next आता है आपका endogenous infection. ठीक है, next comes your endogenous infection. ठीक है, what is endogenous infection? Endogenous infection means the infection that is taking place inside your body. ठीक है, कोई भी इन्फेक्शन जो होता है आपके बॉडी के अंदर ही वो मल्टीप्लाई करना शुरू करता है. दैट सोर्स इज ऑल्सो फ्रॉम इनसाइड योर बॉडी, दैट इज कंप्लीटली ड्यू टू इनसाइड योर इंटरनल एनवायरमेंट ऑफ योर बॉडी. दैट इज कॉल्ड एज एंडोजिनस. एंडो मीन्स इनसाइड योर बॉडी. ओके, दैट इज कॉल्ड एज योर एंडोजिनस इन्फेक्शन. अच्छा, the next is just its opposite, that is your okay. Oh, I'm taking this. Next is your exogenous infection. Exogenous infection means exogenous infection just is the opposite of your endogenous. Endo means from आपका कोई भी internal environment से source लेकर the infection is taking place in your body. Exogenous means कोई भी बाहर से कोई भी infection from the external source. Exo means outside your body. If the infection is originating due to any external factor or due to outside environment of your body that is taking place in you, okay, that is called as your exogenous infection. ठीक है, तो ये आपके कुछ इंपॉर्टेंट टाइप्स है. ओके, दैट इज प्राइमरी इन्फेक्शन, जो जैसे कि मैंने कहा, दैट होस्ट विच इज फॉर द फर्स्ट टाइम इनिशियली इट इज अफेक्टिंग यू और इन्फेक्टिंग यू, दैट इज योर, जिससे आपको प्रीवियसली यू वर नॉट इन्फेक्टेड बाय दैट, दैट इज योर प्राइमरी इन्फेक्शन. Reinfection means again you have already recovered, you have taken medications, now you're all right. Again, that same infection is again causing, is having that pathogenicity to cause infection in you. Okay, that is a reinfection. Secondary infection means you're already infected with some disease conditions, and then you have getting, during that time only you are getting infected by the some other external pathogen. That is called as a secondary infection. Iatrogenic infection means, iatrogenic infection means the infection which is taking place in you during any diagnostic procedure or due to any therapeutic procedures undergoing right now in you, due to you in hospital या फिर कहीं भी. ठीक है. And endogenous and exogenous means, endogenous means the source that is from due to your inside body. Okay, the source is within you, the infection which is originating due to within some factors in you only, that is taking place in yourself. And exogenous means the infection which is taking place outside the body, some factors जो है जो outside से responsible in your exogenous factors. Okay, ठीक है. दिस इज नॉट येट, और भी बहुत सारे खास करके वन मोर इम्पॉर्टेंट टाइप ऑफ इन्फेक्शन इज देयर which we gonna next understand in the next slide. Okay, so I hope you are clear with these types of infection. Basically there are 7 types of infection we're gonna study today. That is first your primary, secondary infection, reinfection, iatrogenic infection, endogenous infection, exogenous infection. Another is your nosocomial infection. अभी हम नोजोकोमियल नहीं कहते, नाउ वी आर सेइंग इट. ओके, नोजोकोमियल ही कहते हैं, बट बेसिकली पहले हम क्या कहते हैं ना, हॉस्पिटल एक्वायर इन्फेक्शन हम कहते थे, which is now being changed to hospital care associated infection. ओके, एम आई क्लियर? ठीक है. तो पहले हम उसे नोजोकोमियल इन्फेक्शन कहते थे, HAI. अभी भी हम नोजोकोमियल कहते हैं, लेकिन उसका नाम थोड़ा सा चेंज हो गया, दैट इज हॉस्पिटल केयर एसोसिएटेड इन्फेक्शन. तो ये जो है, इट इज वेरी इंपॉर्टेंट टाइप ऑफ इन्फेक्शन. मीन्स एनी इन्फेक्शन which you are getting during your hospital stay. Previously you were not infected with it, आपको previously वो इन्फेक्शन नहीं हुआ था, but during the hospital stay due to any procedures or due to any equipments जो आपको लगाए गए हैं, या फिर due to any aseptic procedures. Okay, means during any septic procedures, मतलब proper aseptic measurements नहीं लिए गए थे, proper hygiene नहीं maintain किया गया था, और due to any conditions अगर आपको infection होता है during your hospital stay, that is called as your nosocomial infection. कितना, let me remember. अच्छा क्या हो रहा है पता नहीं, काफी ये हो गया. ओके, ठीक है. विद इन 48 आवर्स और मोर आफ्टर एडमिशन. ठीक है, आपने हॉस्पिटल में एडमिशन लिया है. ठीक है. सो विद इन 48 आवर्स और उससे ज्यादा के बाद. ठीक है, मान लीजिए मैं हॉस्पिटल में एडमिशन लेती हूँ. ठीक है, टुडे आई एम गेटिंग एडमिटेड इन हॉस्पिटल, कोई भी हॉस्पिटल हो, एम्स हो, सम हो, any hospital. Okay, KIMS or Kalinga, whatever, many hospitals are there all over the world. Okay, so कोई भी hospital I'm taking admission. ठीक है, एडमिशन लेने के विद इन 48 आवर्स, 2 days और मोर देन दैट भी हो सकता है, विद इन 2 to 3 days ऑफ टेकिंग एडमिशन यू आर गेटिंग डायग्नोस्ड विद सम अदर डिजीज कंडीशन. आप लेने गए थे एडमिशन फॉर ड्यू टू एनी और अपेंडिसाइटिस और एनी GI डिसऑर्डर्स और कोई भी डिसऑर्डर्स. ठीक है, एनी कार्डियोस्कुलर डिजीज. बट आफ्टर 2 to 3 days, आफ्टर 40 to 72 hours ऑफ योर एडमिशन, यू आर गेटिंग डायग्नोस्ड विद सम न्यू इन्फेक्शन जो आपको पहले से था नहीं. ठीक है, जो आपको पहले से नहीं था. If that kind of infection is being seen in you, that means you are being affected with nosocomial infection or HCAI. Okay, mark my words, this is HCI. This is very very important from your exam point of view. It can come in exam. So 48 hours or more after admission. ठीक है. Then next, अगर you need to understand, within 30 days after surgery. ठीक है, आपने कोई भी सर्जरी करवाया है, ठीक है, कोई भी सर्जरी हो, एब्डोमिनल सर्जरी और योर CABG हो, या फिर कोई भी एनी सर्जरी इफ यू हैव डन. ओके, within 30 days of that, आज आपने सर्जरी कराया, आज से लेकर within 30 days और after that if you are getting infection, you have to note this duration, 30 days. If you're getting any infection or signs of infection, that means also, that is also an example of a nosocomial infection. एडमिशन की 48 to 72 आवर्स हो, या फिर सर्जरी विद इन 30 डेज का सर्जरी के ड्यूरेशन के बीच में हो, या फिर विद इन 3 days आफ्टर डिस्चार्ज. You have taken admission, now you are getting discharge. Okay, you have taken admission, now you are getting up discharge हो रहे हो. ठीक है, डिस्चार्ज के 72 आवर्स के दौरान, ड्यूरिंग द 72 आवर्स आफ्टर डिस्चार्ज, अब डिस्चार्ज हो गए, नाउ यू आर गोइंग टू होम. After that, within 72 hours or within 3 days, if you're getting any infection, any illness, any signs of symptoms or anything, you are again diagnosed with some new infection, means again that is also due to your nosocomial infection or HCA. ठीक है, this is a question can come from this and you need to note all these things. This is very very important from your exam point of view. ठीक है, so आपको पूछ सकता है कि nosocomial infection, how many days within the surgery if it is called as nosocomial infection, within 30 days. Within how much time of your discharge nosocomial infection it is called, 3 days or 72 hours, और ये जो है आपको 48 hours or more within that. ठीक है, you need to know this. Am I clear till this? Yes, okay. अच्छा, एक और चीज भी है, नोजोकोमियल इन्फेक्शन इज नॉट ओवर येट. समटाइम्स नोजोकोमियल इन्फेक्शन कैन ऑल्सो, ये तो हॉस्पिटल स्टे, but it can also be caused by some devices. If due to devices you are getting nosocomial infection, that is also categorized as in your nosocomial infection. ठीक है, जैसे कि due to any devices, जैसे कि the first thing is your Klapshi. Okay, then second is your 40, then third one is a VAP. These three also are categorized as your nosocomial infection. ठीक है, these three also are categorized as a nosocomial infection, but these are caused by devices. Okay, nosocomial infection categorized in due to being acquainted with devices. कैसे devices? First of all, you need to understand what are their full forms. Okay, what is Klapshi? What is Klapshi? Klapshi is your central line associated bloodstream infection. Okay, so basically what is, I'm not writing it, okay, I'm just dictating it. Central line, C for central line, associated bloodstream infection, that is your Klapshi. ठीक है, that means during the just means for example कोई भी reason, okay, you are being आपको लगाया जा रहा है, you are being installed with central line, एक patient को introduced करवाया जा रहा है. ठीक है, the doctor is doing the procedure. Okay, central line is being equipped in the patient. Okay, during that the doctor has not taken any particular hygienic practices, or he had not maintained the sterility practices that he's supposed to do during that procedure. नहीं किया. So due to which some infection, or the nurse also while administering medications through the all those 3 tubings, so ठीक है, she has not properly cleaned that tube. Okay, she has not flushed it properly, so due to which the person is undergoing infection right now. That is also ranged or categorized as your nosocomial infection. ये ऐसा, तो इस जो infection को हम क्या नाम देते हैं, we are giving it a term as your Klapshi. That is because this infection is caused due to central line. That means central line associated bloodstream infection. Bloodstream means the central line is closely related, it is being installed in your vein, right? So that is the thing we are understood, we need to understand. Okay, ठीक है, फिर आपका आता है COTY. What is COTY? That is your catheter associated urinary tract infection. This is very common term and a very important question is related to this. Just stay tuned with me, I'll be telling you that question. Okay, कैसा question आता है, I'll be telling you, just listen to me first. So that is means your catheter associated, for example, we have to install or we have to introduce catheter in a person because the person is having being diagnosed with urinary retention or urinary incontinence, or pregnant patient due to which she is having urinary leakage. ठीक है? So bladder is incontinent or bladder is unable to hold sufficient urine. ठीक है? Due to which she is getting she is frequently suffering, or he or she is frequently suffering from your urinary incontinence. ठीक है? तो due to which हमें catheterization कराना पड़ता है. Okay, but ड्यूरिंग अगेन द सेम थिंग हैपन्स, अगर आप कोई भी स्टेराइल प्रोसीजर मेंटेन नहीं कर पा रहे हो, इफ यू आर नॉट एबल टू टेक प्रॉपर एसेप्टिक टेक्निक्स ड्यूरिंग द प्रोसीजर, या फिर उसके बाद नर्स ड्यूरिंग शी इज क्लीनिंग और शी इज फ्लशिंग दोज ट्यूब, you know, during that time also, if she is not using have washing her hands or not taking any proper hygienic practices also, that time potty can take place. That is a catheter से catheter associated urinary tract infection, यूटीआई हो सकता है. ठीक है. देन नेक्स्ट कम्स इज योर वैप. वैप इज योर वेंटिलेटर एसोसिएटेड निमोनिया. ओके, वैप इज योर वेंटिलेटर एसोसिएटेड निमोनिया. ठीक है. बहुत दिनों तक इफ द पेशेंट इज बीइंग अंडर द मींस इफेक्ट ऑफ योर वेंटिलेटर पेशेंट, प्रॉपर वेंटिलेटेड पेशेंट इज देयर in ICUs, you know, they are not previously having pneumonia, but due to being in impact and ventilated बहुत दिनों तक, means for example more than a week, okay, if they are staying under the impact of ventilators, then also they can suffer from ventilator associated pneumonia. It is quite common. But now the question arises, जो कि मैंने आपको यहाँ पे कहा था, among these three, okay, among these three, which is the most common device associated nosocomial infection? If the question will be asked, most common nosocomial infection due to device associated, what will be your answer? Clapshy, potty, or wrap? The answer is confidently right, potty, because catheterization हर दो पेशेंट में होता रहता है. ठीक है. So it is quite common. So most common nosocomial infection due to associated with being devices, that is your potty, that is your central line associated, I mean sorry, catheter associated urinary tract infection. Okay, this you need to understand. ठीक है. So today we are stopping our classes till today only. Further classes will understand that how we can control it, what are the stages, what are the many things are there. Okay, so आज के लिए we are pausing our class over here. Okay, because ज़्यादा देने से भी ना यहाँ पे ना घुसता नहीं. ठीक है. So today we are completing with this, and stay tuned for the next part. Like, share and subscribe our channel, okay, so that you will be getting more and more useful content in this, and we can teach you in details all the things which is required for your exams and upcoming exams. Okay, so keep preparing, study hard. Okay, all the best all of you. Thank you so much. Okay, have a good day.